News at the White House. If you were just with us, you heard us break the headline about the healthcare plan. Will healthcare be the new infrastructure in the second Trump term? Healthcare week. This was supposed to be it, with a proposal due as early as today on a way to handle the expiration of Obamacare subsidies, the topic that led to the longest government shutdown in history, which Congressman Chuck Fleischman was just talking with us about. He still thinks it was unjust, but here we are. President Trump reportedly set to unveil details of the long-awaited proposal. Remember, concepts of a plan? In this case, a 2-year extension of Obamacare subsidies, COVID-era subsidies, along with new limits on eligibility, income caps for enrollees, minimum premium payments, dubbed the Healthcare Price Cuts Act. Rolled out as soon as today, according to morning reports. The president was going to have an announcement alongside Dr. Oz. And now MS Now, as we call the old MSNBC, which was among the first to report these details, is reporting that the announcement has been postponed with no new date in sight. This becomes a problem knowing the government funding expires on January 30th, and Democrats, at least in the Senate, are banking on a promised vote by John Thune over something. Republicans have been waiting for the president to step in. So we're kind of back to square one. And that's one thing that we're going to be talking about coming up in a moment here. Let's get into it with our panel. Jeannie Sheehan Zaino and Lonnie Chen are with us, Bloomberg Politics contributor. Jeannie Sheehan Zaino is Democracy Visiting Fellow at Harvard Kennedy School's Ash Center. Lonnie is our Republican Strategist Fellow in American Public Policy Studies at the Hoover Institution at Stanford University. Jeannie, I'll get back to where I started. Is this going to be the new infrastructure week? Because a lot of people have been waiting for a plan, not only from Donald Trump, but from the Republican Party, knowing that the ACA was passed, 15 years ago?
Yeah, Joe, God help us all if we have to go through this again. But the reality is there are so many criticisms from all sides of the Republican Party on what is being proposed, which means that nothing has changed in 15 years. This has been a conundrum for Republicans all along, and it continues to be. And you just look at some of the political reality of this. Can you really spend 15 years fighting Obamacare and then swoop in at the last minute after a bad election and a government shutdown and say, hey, you know what, we're going to prop this thing up, and you all on the right just going to have to swallow that because we need to get through the midterm? That's horrible politics to start with. And of course, you have then other criticisms of this, like where are the details about giving people money? How do you cut costs if this is your plan? Very little of this has been talked about. So they went out too early in this trial balloon of an idea without much of the specifics and a lot of pushback politically. So I don't see in this narrow house with the Republicans so narrowly controlling it, how they could get this passed now. I'm not even sure they can do it in the next few weeks.
Well, it seems conservatives on Capitol Hill are upset about this, or pushed back on it, to Jeannie's point. Lonnie, a number interested in how the plan would impact abortion coverage. They were blindsided at not being consulted to begin with, but you see the details here. Healthcare Price Cuts Act, right down to limiting subsidies to individuals with income up to 700% of the federal poverty line. If the White House had actually included lawmakers on this and given them a heads up, would we be seeing a plan unveiled today? What went wrong?
Well, I think some of the challenge goes to this fundamental issue that, Republicans have never voted for really any part of the Affordable Care Act or any of the subsequent expansions. So putting in front of them the idea that they would vote for enhanced subsidies, even with an income cap, even with a very good provision to potentially direct some of the excess from a downgraded plan into a health savings account, I think those are ideas that Republicans would broadly support. I think the challenge is putting Republicans on record with respect to voting for a piece of the Affordable Care Act. By the way, a piece of the Affordable Care Act that's not even working all that well by all accounts. So I think that is part of the challenge. The other issue you have, of course, is that there's a whole suite of other ideas Republicans have talked about to enhance the supply of health care, to help lower costs, improve quality. And those ideas are nowhere to be found in this proposal that the White House has put forward. So I think they are going to have to go back to the drawing board and figure out what provisions are acceptable to congressional Republicans, where there is potentially common ground. And then let's not forget, this is a political issue as well, Joe, going into the midterm elections. Republicans
Big
do
time.
feel some pressure, I think, to put forward an idea, or at least to have their members on record in favor of an idea that can be used to push back against Democrat claims that they have no ideas on health care. So there's all sorts of different dynamics at play here, but the idea that this was going to get all the way through the process and Republicans were all going to be on board today, I think that was pretty ambitious.
So what's Democrats' posture here, or Democrats' expectation, Jeannie, knowing that this is why we shut down? There's a massive expectation for a vote in the Senate if it goes well, or if there's at least some critical mass. I guess there'll be a vote in the House. Or are you just circling January 30 on your calendar for the next shutdown?
We have it on all our calendars, Joe, and it could very well happen, unfortunately. You know, I think Democrats have to own some of the mess that we are in with this. If you are committed to the Obamacare Act and these subsidies, then why do you sunset them after 5 years? They should have made them permanent. They should have done that and been honest with the American people about the cost. So I don't think that Democrats are on the, winning side of this from a policy perspective. What Democrats feel, however, is they are on the winning side of this politically, and that matters to them an awful lot. The president and Republicans, some of their lowest numbers are on healthcare, and specifically healthcare costs. This is almost like the Republicans' version of immigration and crime. It's bad for Republicans. And what the president is trying to do is what he has done consistently with this White House, which is force Republicans to swallow something that is in his interest, but not necessarily in theirs. Because again, when you spend almost 2 decades fighting against Obamacare, are you really going to, in 24, 48, 72 hours, be able to convince Republicans, hey, just go along with it, just extend this thing so we can get through the midterm and the shutdown? That's not going to fly. And I think part of what we're seeing here is part of what we heard after Marjorie Taylor Greene resigned or announced her resignation on Friday, which is some Republicans in Congress feel that they are being run around by this White House and by leadership, and they aren't going to take it on something this sensitive to their base.
Well, this isn't getting any easier, and a great panel to talk about it. Jeannie, thank you. Jeannie Shanzano, Lonnie Chen, our Democratic analyst, Bloomberg Politics contributor, and Republican strategist. Thank you both for the insights today and a great conversation here on Balance of Power.